Right, so we're going to go ahead and get started. I want to thank everyone for jumping on the webinar tonight. I am Tanisha Racing Henry. I am a board certified family nurse practitioner, founder and CEO of Better Days Wellness Clinic. So tonight isn't about fear, it's about awareness and what we can do. If you've been touched by breast cancer, personally or through someone you love, you're in the right place. So before we dive in, make sure that everybody understand this presentation is not to bring about fear, but give you knowledge and maybe some insight on some things that you didn't know about so that you feel empowered once you leave. Okay? If you've been touched by breast cancer personally or through someone you love, you're in the right place. Again, welcome to Awareness to Action, Protecting Your Breast Health. Like I said, I am Tanisha Racing Henry, board certified family nurse practitioner and founder and CEO of Better Days Wellness Clinic. And I am a functional wellness practitioner. All right. So what's my story or what's my connection to breast cancer? As you see these three names on the screen, these women, June, Raquel, and Rodessa, represent why I'm passionate about this conversation. Each of them faced breast cancer in a different way, and their journeys remind me why prevention and early action matter. This is personal. These three individuals are people in my family. So June Rayson was my paternal grandmother. Raquel Boyce was my first cousin. And Rodessa Barrett Porter was my maternal grandmother. So very close connection to breast cancer. So again, like I said, this is personal for me. And it is my goal to help you leave tonight and not just feeling informed, but again, feeling empowered. So, why breast cancer matters? Breast cancer is the most commonly diagnosed cancer of women across the world. In fact, in 2025, here in America, it is estimated that there will be 300,000 plus new diagnoses. Early detection truly saves lives, but the work starts before that, and that's where we get into preventative measures to help reduce the risk of developing breast cancer. So let's look at the reality of racial disparities. White women are diagnosed more often, but Black women die more often. Why do you think that is the case? And feel free to put that in the chat. Why you think that might be the case, that white women have the highest diagnosis rates, but Black women have the highest death rates. And I am going to tell you the answer, so don't feel pressured to put anything in the chat. So, from research and public health statistics and things of that nature, it's believed that Black women have a higher rate of death from breast cancer. Actually, they're up to 40% more likely to die from breast cancer than their white counterparts. And it's believed because one, Black women are usually diagnosed at a younger age, and when that diagnosis is made, it's at a more advanced stage, which you will learn later on contributes to the prognosis and outcome. So that gap reflects systematic differences, right? So when it comes to access, sometimes it's issues of being insured, getting time off from work to go and get screenings and things of that nature, maybe even transportation. So sometimes access is not as available for Black women. Also, awareness. Uh, Breast Cancer Awareness Month, which is this month, obviously, it's more than just, pink ribbons, um, breast cancer struts and walks or brunches. And so it's believed that Black women are not getting educated, not getting enough information um, as their white counterparts. So also the level of awareness could be a factor too. And then the follow-up. So maybe people are getting the mammogram, but then when the mammogram results suggest additional imaging like MRI or ultrasound, or maybe even a biopsy if they see some type of mass, the follow-up is just not being done at the same rates. So when you take in account this racial disparities that we see, how does that play out as far as survival rates? So when it comes to cancer, hitting that 5-year marker is like a big deal, right? So when you see, so as you can see, when uh, abnormalities are caught early, survival rates are extremely high. So localized basically means it's present in maybe one breast and it hasn't spread to lymph nodes or other organs. So this will usually be like your stage 0, stage 1, and we'll get into the stages in a little bit. So early detection before it begins to spread, when it's very contained, you see very, very, very high 5-year survival rates. Regional means it's possibly spread to lymph nodes, and this is where you get a stage 2, stage 3 diagnosis. Still a pretty good 5-year survival rate there. However, as you see distant, that means that it's spread to other organs. Survival rates not as high. So that drop, sharply when cancer spreads. That's why awareness and early action make such a difference. All right. So what actually is breast cancer? At its simplest, it's when abnormal breast cells grow uncontrollably and form a tumor. If untreated, those cells can spread to other parts of the body. Most often, the lungs, liver, brain, or bones. So anyone want to guess the top 3 sites that breast cancer tends to spread to when it goes undetected and untreated? Everybody don't type at once. So I'll give you the answer. The 3 most common areas are bones, lungs, and liver. It also does spread to the brain, but it is not one of the 3 most common places that breast cancer will spread. All right, so types of breast cancer. And many people didn't even realize that it's, different types of breast cancer. So hopefully you find this information beneficial. The most common type is invasive ductal carcinoma, which starts in the milk ducts. All right. The invasive lobular carcinoma begins in the milk glands, and triple negative and HER2 positive cancers tend to behave more aggressively. So, and as you can see, where it starts with those two can vary, and they're very aggressive, harder to treat, and spread faster. And unfortunately, triple negative is more common in Black women. So that also plays a part in that death rate, why we see Black women dying at a higher rate than their white counterparts. So why is this important? Why is this important? Knowing the type of cancer that a person has helps guide the treatment and the prognosis. So it's very important. Again, if you have one of these, or you know someone who gets diagnosed with those aggressive, fast spreading forms of cancer, you want to catch that super early so that the treatments and prognosis can be better. All right, so you've probably heard people say, oh, the breast cancer was stage this or stage that. So here's a bit of info, just to get a good idea of what all that means. So stage 0, which we usually don't hear too often, people refer to it as that. Um, and it's usually because at this point it's just that the abnormal cells kind of coming together in the ducts, right? It hasn't spread beyond the ducts. So stage 1 and 2, this is where small tumors have formed. It may involve nearby lymph nodes, and this is at the stage that if it wasn't caught on a mammogram or some other screening test, this is where we would want people to feel that abnormal lump or feeling in their breast so that they can get it checked out. Awareness is so important in screening and other things that we're going to talk about. So stage 3, it's it's the tumor is usually larger, spread to more lymph nodes. Stage 4, the cancer has spread to distant organs like we just talked about, liver, lungs, brain, and bones. So every stage tells a story of timing. So the earlier, the better. So hopefully you're catching the uh, theme of breast cancer awareness to action. The sooner, the better, right? That you catch it. So now let's get into how do we move towards prevention? How do we move towards prevention, lowering our risk, and things that are in our control? So risk factors. Risk factors is when you have these different things, components that can either give you a high risk, low risk, moderate risk, things of that nature. So non-modifiable. That means things you have no control over. You cannot change it. And so if you see here, being a woman, being 50 plus, having a family history of breast cancer, testing positive for genetic mutations like the BRCA gene, or having a previous personal history of breast cancer. These are all things that it's nothing you can do about it. You can't change them. These are the things we can't change. And, but the knowledge is powerful. Knowing your family history helps you take earlier action. And let's see, who here knows if they have a first degree relative who's had breast cancer? So a first degree relative is someone that you share like at least 50% DNA similarity. So that will be your parent, a sibling, or your child. Okay, so that's considered a first degree relative, because that makes a difference. Anytime you go to your primary care provider or your OB/GYN, they want to know everybody. So even if you tell them about grandmothers or aunts or cousins, they still want to know, because that again plays into the level of your risk. But when it's a first degree relative, like I said, parent, sibling, or child, you definitely want to make sure that your provider knows about that so that they can calculate your risk. All right. Okay. So we have somebody who gave us their, right. You have 3 risks out of the 5. So those 3 things, nothing you can do about. All right. So let's go to modifiable. These are, for the most part, lifestyle choices and habits. So these are things that we can change. Um, so lifestyle plays a big role in maintaining a healthy weight. We want to make sure we're limiting alcohol, avoiding smoking, staying active, and eating well. Even small shifts like walking daily or swapping sugary drinks for water make measurable differences. So, give you a little bit of example. I knew someone who drank two, um, what do you call them? I guess like 32-ounce fountain Coca-Cola drinks every day, every single day. And so they went down to one. They did nothing else. They just went down to one a day. And within a year, they had lost 10 pounds just by that one thing. Now, should they still been drinking 32 ounces of fountain Coca-Cola a day? No. But just showing how, small changes can make a difference. So they had lost 10 pounds. They, obviously wasn't consuming twice the amount of sugar from the pop and things of that nature. So, areas that we can make a difference in helping to lower our risk in developing breast cancer is, getting down to a healthy weight and maintaining it, uh, being mindful of our alcohol use, making sure that we're getting out and about. And exercise doesn't have to be intense. It can be simply walking 20, 30 minutes a day, not becoming a smoker, not using long-term hormone therapy. And then long-term, that also includes being on oral birth control or some type of birth control for a long period of time. And then poor diet, just not making good food choices due to, whatever it may be. So these are things that we can change. So this is where we want to put our attention. So warning signs, warning signs. What are we looking for? So when it comes to being alert to what your normal is, things that you want to look for, any new lump in the breast or underarm, swelling or thickening of the breast tissue, skin dimpling. If you're not sure what skin dimpling looks, if your breast starts to look like how an orange looks, you know how an orange has all those little dimples in it. If your breast starts to look that way, that's a warning sign. If you have unexplained redness or flaky skin, if your nipple is pulling inward, so it's as if like if you know a person with like an Audi belly button, if you was to poke them in, how it would go in. If your nipple is doing that by itself, that's a warning sign. If you're having pain in the nipple, if you're having unusual discharge, you should not have any discharge coming out your nipple unless you have something hormonally going on like breastfeeding or something like that. So that's a warning sign too. And then just breast pain that doesn't go away. Those are warning signs. So um, these are things you don't want to ignore. These are all worth making an appointment and getting checked out because you want to know your normal. What's your normal? Changes don't always mean cancer, so keep that in mind as well, but they always mean check it out. All right. And so we're going to go in a little bit about how do you identify, what's the ways that you can identify what's normal for your breast and breast tissue. So again, talking about screening and early detection. So the guidelines are that women start having mammograms at 40 years old, unless there's a family history or genetic suggests earlier. So that means that you have actually gotten the BRCA test and it came back positive. However, if your youngest relative, let's say, was diagnosed at 38 with breast cancer, then the guidelines suggest you start 10 years before then. However, mammograms are not recommended for anyone under 30. So what do you do just because you are not getting a mammogram at 28? You definitely want to have that relationship established with your primary care doctor or your OB-GYN, whoever you're kind of going to for gynae care. And the clinical breast exam that they perform in office, as well as the monthly self exam that you should be doing at home. And then that way, because you can still get like ultrasounds, like if there's something kind of noted and you're 28 years old, you can still get like an ultrasound, and other testing can be done. So just because they say don't start getting the mammograms at 30, don't ignore any abnormal feelings in the breast. And then also that helps you establish a baseline as to what your normal looks like and feels like. So, monthly self breast exams and those clinical breast exams are key. Awareness isn't optional. So that's the only way you can kind of establish what your normal is. If you've ever switched medical groups or insurance, you may, if you're over 40 or have gotten at least a couple of mammograms, if you switched insurance or you switched medical groups, a lot of times that radiologist, that new radiologist will ask, do you have can you provide us with the information, or do you have your last few mammograms on a disc? Because they may see something, but they want to see, and we're going to talk about what they could be seeing or not seeing. Is that normal? Or should they, recommend additional imaging or biopsy or something to that nature? So establishing the normal, what's normal for you, is very important. So here's why they may request your previous mammogram images. And it's due to dense breast tissue, what we all need to know. So half of women over the age of 40 have dense breast tissue. It's normal. Why it matters is because it puts you at a slightly higher risk. Not so much of developing breast cancer per se. It's more with the detection of it. So dense breast tissue itself, it does kind of increase the chance of developing breast cancer, but it's more so what they can't see. Okay, so it's harder to see on mammograms. On a mammogram, let me go back, sorry. On the mammogram, the dense tissue looks white, and tumors also look white. So that can make a difficult to spot cancer early. So that, as we were just talking about, that's why they want to see those images. To one, see, did it grow? Is it in the same spot? Things of that nature, so that you're not getting unnecessary testing and things of that nature. So a little bit more about dense breast tissue. Dense tissue just means it's more granular tissue and less fat, but it can make it harder to detect, like I said, cancer on a mammogram. If your report, if you've ever seen this, says dense breast, if it doesn't already make a recommendation, have a conversation with your provider as to whether you should have extra screening, like an ultrasound or an MRI. And it's just to, have peace of mind and make sure they're not missing anything. And I can relate to this because I've been hearing about it since I started getting mammograms. And so, yes, it's a pain in the butt sometimes because it's not like they can do it all at once. But I can assure you, having the peace of mind of having your ultrasound or your breast MRI come back clear, it in the end is worth it. So stay consistent. Regular screening is still the best defense, even if you need that additional imaging. Now, let's get to the part that most people don't talk about when it comes to decreasing our chances of developing breast cancer, and what things we can do to prevent it. And that is the connection between gut health and the breast. So people are really surprised to hear about this, but the gut plays a huge role in breast health. Your gut microbiome, which is basically, think of it like your gut's own ecosystem, right? Its own little community. So your gut microbiome helps regulate estrogen levels. And what that means is it metabolizes estrogen, which means how the body breaks down and clears out estrogen after it uses what it needs. Too much estrogen equals higher breast cancer risk. So the gut is responsible for helping with regulating those levels. When your gut microbiome is off, um, what it's called is dysbiosis. And what that means is the bad bacteria is greater than the good bacteria. And so obviously in any situation, if you have more bad than good, that's not a good thing, right? And so it's called dysbiosis. And it's dysbiosis that can also increase that breast cancer risk, right? So if your gut microbiome is off and due to the dysbiosis and the gut cannot metabolize and process that estrogen, now you just have extra estrogen circulating. And that's what cancer cells love. And it's very important to try to get your gut health optimized because those two things alone can greatly reduce that chance of developing cancer. So, when you have dysbiosis going on, it causes a lot of inflammation. And when you have a lot of inflammation, the gut microbiome is not able to be diverse, right, to support your immunity. So now you have a weakened immune system. Again, it's a situation where cancer cells thrive and love. So, what's the best way to help keep those breast cancer risks low is to focus on the gut. A balanced gut strengthens your immune system and it helps your body clear that excess hormone, estrogen, that, like we mentioned, instead of just lingering in the body. This is where lifestyle changes again really shine and can come through. So, in order to help with the gut, right, in those modifiable risks that we talked about, the reset framework that we use here at Better Days is an excellent way to make small steps but have a big impact. So reset your habits. It can improve your gut health and reduce your cancer risk at the same time. So you can look at it like this. R is for restore. So gut health and detox support help reduce inflammation. What did I just tell you? When you have like an inflamed gut, it weakens your immunity and it gives cancer a place to thrive. So eating balanced, nutritious meals, more fiber. Good bacteria loves fiber. And so eating enough fiber helps prevent dysbiosis from happening, or you can heal the gut out of that state of dysbiosis. So, eating plenty of fruits and vegetables and eating less processed sugar and just processed food altogether, staying away from GMO and eating organic when possible. S stands for sleep and stress management. Lowering your cortisol. So cortisol for many people is always high because they either have stressful jobs, stressful home lives, or a combination of the two. And people do not get enough sleep. You need 7 to 8 continuous hours of sleep nightly to give the body time to heal and repair itself. And that includes what's going on in your gut. E is for exercise. You want to have daily movement to regulate those hormones as well as help you maintain a healthy weight. And then T is transformation. This is where your mindset and you start to have those shifts where you're being consistent in those small steps, those small changes daily that turn into weekly, that turn into monthly, that turn into just how you go about living a healthier lifestyle. And so it's consistency with the healthy habits over perfection. So don't look at it like a diet, but more of a way of life, to improve your health and give you longevity and have you function, at an optimal level and not be at risk with so many chronic conditions like breast cancer. So, which of these gut-friendly habits feels doable this week? Could you start doing a 20-minute daily walk here in the Chicagoland area? Things have definitely cooled off. So maybe walking outside might not be that appealing, but you can always buy a walking pad or see if your job has like a little gym that you can do 20 minutes after lunch or something like that. It doesn't have to be a lot. It's just the consistency of it. Maybe swapping out sugary drinks for water, eating more vegetables, and limiting alcohol. And obviously, scheduling your mammogram if you're over 40. All right. So it's about simple wins, walking daily, eating more vegetables, hydrating with water, limiting alcohol, and making sure that we are up to date on our mammogram. It's not about doing everything. It's about doing something and sticking with it. Okay? Key points to remember. Family history matters. Start your mammograms earlier if there's that family history, but not before age 30. But it doesn't mean if you feel something and you're 27 and your mom, got diagnosed at an early age, definitely go in. They can do an ultrasound or MRI to see what's going on. BRCA genes can be found through genetic testing. So you can always ask your primary care doctor or whoever kind of takes care of your women health needs about getting tested. Hormone therapy, especially when you do estrogen and progesterone, long term, it can raise your breast cancer risk. So make sure you are having a good conversation, a clear conversation with your provider when it comes to being on those particular hormone therapies for an extended period of time. Remember that dense breast tissue is common and it can make mammograms harder to read, but there's always things that you can do to follow up to get the most out of your screening opportunities. And so prevention is powerful. Lifestyle screening and awareness all add up. And the R.E.S.E.T framework gives you a practical way to live this daily. I jumped ahead a little bit. So Reflection and empowerment. What's one thing you learned today that you didn't know before? And based on what you learned today, what's one thing you will implement to reduce your breast cancer risk? So you could come off mute, you can put it in the chat, whichever one you feel comfortable doing.
My one thing is to make sure I get my health, obesity under control, get more exercise, drink more water, and keep a self breast exam.
Okay,
Every
you got a lot. You learned a lot.
Yes, ma'am. I did.
Okay. Okay, those are all good things. Yes, continuing to work on weight, continuing to work on getting movement, and the self-exams are all big. All right, we got people in the chat saying, um, really work on my gut health and get more sleep. Yes, those are all very critical things that can make a difference in our longevity as well as our health and wellness as we continue to get older. So remember, your health is worth prioritizing. Don't wait for the perfect time. Start with one choice today. So you don't have to do all things, but just start with one thing and become consistent with that and then add to the next. So thank you so much. Remember, good habits today, shape tomorrow. If you want help putting this into practice, schedule a mini wellness strategy session with me. You can do that at betterdayswc.com, or you can follow us on our socials to stay connected. Protecting your breast health is lifelong work, but it's doable. It's one reset at a time. Thank you all for joining tonight. Take what you have learned and act on it. Remember, awareness is the first step, action is the change.